I want to thank everyone for coming out today, and I think we're sending a message not only to Bayonne Medical Center, but to many of the hospitals in the area. I don't know if you're all aware, but there are 8 hospitals in HPAE whose contracts expire on May 31st. And that represents about nearly 7,000 nurses and healthcare workers. And these hospitals are located throughout the state, but several are in Hudson County. I am pleased to report, however, that 2 of the hospitals just settled, one last night, and that's Cooper University Hospital, and we have some of the members here. And Southern Ocean County Hospital from Manahawkin, we have members here. And then the other hospitals are Christ Hospital, Palisades Medical Center, Englewood Hospital, Meadowlands, Virtua, and of course Bayonne. We knew going into these negotiations that they'd be tough negotiations, not only because of, in the case of Bayonne, because of the financial crisis that this hospital faced a year ago, but because these are financially difficult times throughout the state and throughout the country. And so our proposals have been fairly modest as we have approached the bargaining tables. But that's not to say that our approach at the bargaining table is going to be one where we accept compromise. When the times are tough like this, particularly economic times are tough, this is not the time to lower standards. It is not the time to relax safety practices. It's not the time to reduce staffing. In fact, these are the times to increase all of those things. And that's why our focus has been on strengthening the care that's given at the hospital, strengthening to make sure that the patients are safe and the workers are safe. And these are the key components. Many of you also know that we did a survey in the past few months to evaluate what goes on in the hospitals and are there other ways to save money. And we have found numerous ways in which money can be saved in our hospitals. Our members have spied and documented so much unnecessary expenditures, whether it is the constant use of paper being produced through machines that go from the copy machine right into the trash basket, whether it's the inefficiency of sterile trays and the fact that they cost so much they get charged, patients get charged so much when one tray is open, and if that tray is missing one little piece, they open a second tray and charge patients even more. There's a lot of things which seem like that they could be small in terms of issues, but they can be very important in terms of saving money. And we're saying we'll help the hospitals do things like that. We will be partners with the hospitals to cut costs and to be more efficient. But what we cannot do is be partners in lowering the standards of care, lowering the quality of care. That happens to be one of my personal heroes, and that's Donna Benjamin, president of the Bayonne Local 5185.
I want to thank everybody sincerely from the bottom of our hearts to come up and help support us, because we are dealing with a bunch of renegades right now. We have a group, I call them the alphabet soup, that purchased our hospital, and all we ever hear is, they're the owners, they saved us. They didn't save us. Our members saved us on their back. I also have to thank Commissioner Doria, our former Mayor Malloy, our present Mayor Smith, Albio Sierras, our senator, our assemblyman, our Senator Menendez, our city council members, and Mayor Turner, our freeholders, and last but not least, Mary Jane Desmond, who had the strength to be the chairperson of the Coalition to Save Bayonne Medical Center. Mary Jane, wherever you are, come up here. I really think that we've got to start right now, today, to get that coalition moving again and show them who owns that hospital. The people of Bayonne deserve access to quality patient care, and that's all we care about. We cannot stand to have people hide their books, make money off our members' backs, and make money off our poor people that live in the community here and the surrounding area that need health care. Let's show them who's going to run that hospital, not them, us.
Donna Benjamin is a hero. So is everyone in HPAE, every worker that walks through those halls who was there in 2006 and prior, and those of you who have been there since. You saved the hospital. I was very, very happy to participate as a community member and stand beside you, but you saved that hospital. You've already given back. There's no mistake about who saved the Bayonne Medical Center. Meetings with attorney deputy generals in 2 different states, going to court, fighting all the way, putting the feet of elected officials straight on the fire and begging for help. And finally, it seemed to have come. But where are you? You saved our hospital, and there were some for-profit entities standing on the sidelines, and I hate to say it in retrospect, they must have been licking their chops because they're looking for you to do it again. I was just a patient here, came through the emergency room, wound up on the floor, into an OR, and back home with my family. Thank you. Thank you for still being here. Where would I have gone? And trust me, sick is not fun. Not even when you're getting well sometimes. But I thank you, and I thank your colleagues. And as far as bringing the coalition back, it's been in my heart ever since. It's never gone away. I stepped back personally because I thought you had the fight, and it was more personal for you. But people forget, you're not just healthcare workers. You're mothers and fathers. You have families, you have siblings, you have parents that you're trying to take care of. So giving back more, it's that whole domino again. But people who don't live in this community, who take over a facility like this, which is a community facility, I don't know who people think the former owners were. I still think it's us. We live here. But I want to tell you, I will find everybody I can to stand with you. I am praying for you in those negotiations. I am so happy to hear who some of the people are sitting around that table, because you're the very group that spearheaded this 2 years ago. It was before 2 years ago, as a matter of fact, because you held town meetings trying to even get someone like me to see what was going on. And that started, I believe, in 2004. You knew. You knew, you were there. Thank you. We want to be here for you too. We need this place. I wish you luck, but I pledge my anything I can do to help.
They should be.
Find some more red shirts across the street.
Hello. Morning, Earl.